Good morning, everyone. This is day 6 of the Dr. Joanne Lewis Foundation Heart Healthy Walk Challenge. And yes, I'm just rolling out of bed. I have to do this now because I have such a long and busy day today. I will not have a chance to do a video later. And I encourage you all to, wherever you are, whatever you're doing, to just take 15 minutes out. So I have to lead by example, right? No matter what I'm doing, no matter what time it is, no matter how tired I feel, I need to find at least 15 minutes during the day. And right now, this is the 15 minutes that I have is right before I get ready to take a shower, put on some clothes, and get to work. So why are we doing this? We are trying to raise awareness of heart disease. As you know, February is Heart Disease Awareness Month. And every February, the Dr. Joanne Lewis Foundation takes the whole month and we do the walk challenge. And you will see along the way, depending on where I am, different people walking with me. Actually, yesterday we were supposed to do the walk at work, and we just got so busy we didn't get a chance to do it. And I didn't want to take a chance today of not being able to have anyone participate and the time getting away from me. So I decided I'm just going to do it before work. So here we are today on day 6. So heart disease, raising awareness regarding heart disease, because it's killing just millions of people of all ages, of all races. And we talked a little bit in the other videos, the different types of heart disease. I need to get my heart pumping early this morning. I already did my meditation. I did my prayer, and now I'm doing this walk. Then I'll take my shower and eat my breakfast and get on my way. So I appreciate anyone who can join us and share your videos, your walking videos, even if it's a little snippet, just to let us know that you are taking the time to walk. And as you walk, move those extremities and release some nitric oxide, so that your blood vessels can, look at all that wiggle. Yes, that has to get firmed up. It's just the way that I had my arms. Anyway, so to understand the causes of heart disease, we need to know how the heart works, right? So the heart has 4 chambers in the heart. There are 2 upper chambers that are called the atria, and the 2 lower chambers are called the ventricles. So the right side of the heart moves blood to the lungs through the pulmonary arteries. And in the lungs, the blood gets oxygen, and the oxygen-rich blood goes to the left side of the heart through the pulmonary veins. Okay, so that's why it's very important. So when we talk about coronary artery disease and the diseased blood vessels, that if these vessels are diseased, they can't really carry the blood through, okay? And so the left side of the heart then pumps the blood through the body's main artery, which is the aorta. And then it goes to the rest. I gotta keep moving up. The rest of the body. So there's heart valves in the heart. We talked about the pulmonary artery and the pulmonary veins. But the valves are the aortic valve, the mitral valve. You hear some people sometimes say that they have a murmur, or they have mitral valve prolapse. So, sorry, I lost my train of thought. So aortic valve, mitral valve, pulmonary valve and tricuspid valve. And each of these valves have flaps, and they're called leaflets. And then, so these flaps, they open and they close during each heartbeat, okay? So if a valve flap doesn't open or close properly, so you have less blood moving out of the heart and to the rest of the body, okay? Got that one? Okay, all right. Trying to, because we have to know how the heart works, right? We have to know how the heart works. Not just, you know, structurally, but talking about valves and pulmonary artery and pulmonary vein, but in the aorta, we have to know that it has also an electrical system. So, so the electrical system is what causes the heartbeats. Okay, so the heart's electrical system, it keeps the heart beating, and it had the electrical signals. They start in a group of cells at the top of the heart called the sinus node, and they go along a pathway between the upper and lower chambers of the heart. Remember, I mentioned the atria and the ventricles. Well, it goes through the upper and lower chambers of the heart, and it's called the atrioventricular node. Okay, so the movement of these signal causes the heart to squeeze and pump blood. Okay, so remember when I was talking about coronary artery disease, so when there's a buildup of plaque or fatty substances in the arteries, that's called atherosclerosis. And that's really the most common cause of coronary artery disease, okay? We talk about a lot, oh, did my music stop? Okay. We talk a lot about risk factors. So some of those risk factors include like eating an unhealthy diet. When you don't exercise, this is why it's very important for us to take the time and just do this walk. I have another t-shirt under this that's really bothering me. So it includes, risk factors include eating like high fatty foods, high salt foods, just an unhealthy diet, low in fruits and vegetables. Like I said, lack of exercise, obesity, and smoking are all risk factors, okay? So if we learn how to develop a healthier lifestyle, we can lower the risk of atherosclerosis. And it all takes just commitment, you know, and this takes a lot of commitment. Saying that I'm going to walk with you 15 minutes a day, it takes commitment and it takes discipline. So this is why it's very important, you know, that to dedicate yourself to something and to keep on going it. So we talked about that electrical system that causes the heart to beat. So in that electrical system, and I have a little bit of a headache. I think it's because I'm doing this walk and haven't eaten anything yet. But there's a disturbance in that electrical system called arrhythmias. Okay, so can be caused, you know, like so common causes of arrhythmias in the heart and some conditions that may lead to those arrhythmias, which is the irregular heartbeat, okay? Or if you have disease in the heart muscle itself, which is called cardiomyopathy. If you have disease in the blood vessels, which is the coronary artery disease, diabetes, okay? Sometimes people who use illegal drugs, such as cocaine, can develop these disturbances in the electrical system of the heart. Sorry, I know I'm doing this within a limited space, only because there are other people sleeping still, and I'm trying to do it in a very quiet place. And I look a pure mess right now, but just walk, just walk. Don't be too critical. Don't judge. No judgment zone, okay? No judgment zone. I'm walking. I got up and I started to walk. Okay, so emotional stress. Oh my goodness. That can cause some arrhythmias also, and disturbances in the electrical system of the heart. And a lot of us have been under a lot of emotional stress. Too much alcohol or caffeine can cause it. Arrhythmias, and sometimes you may have some conditions from birth, some genetic defects that can cause it. High blood pressure can cause these electrical disturbances called arrhythmias. Smoking can cause it. Any diseases of the heart. So we talked about different things that can cause these arrhythmias. So during some of my other walks, I also talk about this music is too loud. Some other risk factors, such as age. I think I need to speed it up a little bit. So the older we are, the more increased risk of damage and narrowed arteries, blood vessels, or weakening of the heart muscles that can lead to heart disease, okay? So men are generally at a greater risk of heart disease, but once women pass menopause, their risk also increase. If you have a family history is very significant. That increases the risk of coronary artery disease, and I have it on both my mom and my dad's side. So that's why I try to stay active, although sometimes I don't do a very good job. So, for example, like before the age of 55, for a male relative such as a brother or your father, and 65 for a female relative such as your mother and sister, if they have coronary artery disease, more likely you will have coronary artery disease. Smoking. If you smoke, please quit. I keep talking about it and talking about it. I feel like a broken record. And just eating a healthy, there are things you can't change. There are things that you can change. You know that eating an unhealthy diet may cause it. So please, improve what we eat. More fruits, vegetables, decrease the amount of alcohol. Manage your blood pressure. High blood pressure is does not control, cause damage to your arteries. They become hard, they become thick, and they alter the blood flow to your heart and thus to the rest of your body. So high blood pressure can not only cause heart disease, but other damage to other parts of your body. Cholesterol, manage your cholesterol. Diabetes, manage your blood sugars, okay? Like I said, stay active, okay? So this is day 6. We're coming down to our 15 minutes. And I just want to say, you don't have to stop at 15 minutes. Just keep going. I have to stop because I have to go take a shower and I have to go to work. But if you want to continue on, please feel free. Continue on. Walk. Do some stretches. Do some chair yoga, whatever that you feel like doing. Just keep active. During the day, if you feel like taking another 15-minute walk, do it again. And tomorrow we'll meet again. Today is talk therapy day, so I talked enough. I love you. May God bless you. May God keep you. And be consistent and deliberate in whatever you do today.